Hi everyone, and welcome back to another conversation with me. I'm Chief Bioscientist at the Franklin Institute, and we're here to talk about some more science related to the COVID-19 pandemic that we're all dealing with. This weekend, I saw a lot more news stories coming out about the utility of wearing masks. And it seems like there's some conflicting advice coming out from some public health officials about whether to wear a mask, when to wear a mask, who should wear a mask. So I wanted to break down some of the confusion around this conversation. And even though we don't specifically actually have a clear answer yet, talk about some factors that we should all keep in mind when we're making this decision. So the first thing that I think is useful to clarify is the distinction between different kinds of masks. So we've all heard about the N95 respirator masks that are the best masks that are out there for protection against a virus like this coronavirus. And these masks are different because of both how they're made and how they work. So one key factor in the effectiveness of the N95 masks is that they're not made from typical woven fabric. So normally when we think about fabric, we think about threads going this way and that way, and they kind of come together to form that weave. So N95 masks, they're actually made from a spun thread of polypropylene is the most common plastic thread that they're made out of. And essentially, instead of being like an organized weave, they're just kind of like a tangled mat. And so these work in a couple of different ways. So first of all, because those threads are so thin and so tightly tangled, they form a physical barrier that can be hard for particles to make their way through. They're effective against both large and small particles. In fact, they're generally tested to keep out 95% of airborne particles. That's where the N95 comes from. But they also go one step further in that they're electrically charged to actually attract particles in the air. So it's not just that physical barrier. It also uses electrical charge to trap these particles. So these N95 respirator masks are the most effective masks that are out there. Now, the second category of medical masks that people have been talking about are those kinds of surgical masks that are, kind of rectangular. They cover the nose and the mouth that surgeons, often wear to protect themselves from bodily fluids during surgery. And that's important because those masks are not tight around the nose and mouth. Unlike an N95 mask that needs to be properly fitted, a surgical mask can just loosely cover the nose and mouth, fit over the ears, and their primary function, again, is to prevent transfer of bodily fluids. And so they're made of generally multiple layers of liquid-resistant material. Sometimes the one closest to your face is made of paper, so it feels soft. Then sandwiched on top of that are a couple of additional layers of that liquid-resistant material. And so altogether, that sandwich is really good at preventing fluids from getting through, but they still let airborne particles in through the sides where they're just not fitted tightly. So those are both types of masks that are being used in healthcare settings right now. And what we're seeing more and more of now is fabric masks. So people are making their own out of fabric and elastic that are roughly, kind of the same size and design as a surgical mask. Those are roughly about as effective as it might be even to just wrap a scarf around your mouth and nose a couple of times. So I'm going to call those fabric masks in general, knowing that they can either be an intentionally designed mask or just a shirt pulled up over your mouth and nose, or a scarf wrapped around a couple of times. And again, it could be a bandana. These will still let small airborne particles through. So they are not as effective as some of these masks that are used in healthcare settings. So hopefully that kind of clarifies the distinction between the different kind of masks that we're talking about. So now that we've clarified that, the second important thing is to think about where these masks get used. Now, most important is that respirators and medical masks are essentially needed in healthcare settings right now. We can't escape the headlines. The US just does not have the supply that's needed to protect doctors, nurses, and other medical personnel who are on the front lines dealing with patients. In fact, these masks are intended to be disposable, that they don't necessarily hold up over time, and yet because of the supply shortage, people are trying to figure out ways to sterilize them and use them over and over again. And so if you're not working in a healthcare setting and you have some of these masks lying around, please consider donating them to healthcare workers who are really relying on these to protect their own health and maintain their capacity to continue treating the patients who need their assistance so badly. Now, what about fabric masks in healthcare settings? Recently, we've seen some calls on social media for people, for everyday citizens to make fabric masks to provide healthcare workers. And there's mixed opinions about this. Even among healthcare workers, there are some who welcome these masks to put them over their N95 masks to try and just make them last a little bit longer. There are others who will take these masks to use outside of dealing with COVID-19 patients so they can save the better protective equipment when they're dealing with coronavirus patients. And then there are some who are just don't see this stopgap as enough. So I'm going to pause here because I think we've got a question.
So does that mean that the virus is a liquid for the surgical mask protection with the weaving?
Right. So it's a great question. So why do we care about liquids and droplets? So the most common way that this virus is communicated from one person to the next is through droplets of airborne particles that come out of your mouth when you spit, when you sneeze, when you talk, when you breathe. And the size of the particle can matter. There are some particles when you sneeze that are big enough that they essentially function as liquid droplets, and those would get blocked by one of these more either a fabric mask or a medical mask. It's the smaller ones, the smaller droplets that could potentially go through either a woven fabric or through the sides of a mask that doesn't fit tightly. That's more of a cause for concern when we're thinking about these other types of masks. Again, the N95 is the one that is most protective against any type of particle size. So as we've been talking about this call for handmade masks from the public, it's important to work with a hospital to know whether they can use it and to know that it'll be used for a purpose that can help with the broader problem that we're facing. So we don't recommend that people just make masks and drop them off on a hospital's doorstep, because every hospital has a different strategy in terms of how they can use these doorsteps. So, of how they can use these masks. So please connect with a local hospital or somebody who's collecting locally before you start putting effort into making masks to donate, because we know that we all want to help, but we want to make sure that the effort that we're putting in is going to be worthwhile. And the other piece of that is that the fact that we have this shortage of protective equipment for our healthcare workers is not something that we're going to be able to solve on an individual basis. This is something that our entire system of production needs to respond to. And so I do encourage you to call your legislators at all levels and urge them to do more, because what we've done so far to ramp up production just hasn't been enough. And so we really need to apply that pressure on the people who can make those changes at a more systemic level. So we know for sure that medical masks are the best ones for healthcare workers. If any of us outside the healthcare industry have masks, it's great to be able to offer those to people who can use it more. Now, the fuzziness in the conversation that I've been seeing in the media over the last few days comes to the best practices for the rest of us. So the challenge here is that we like to look for evidence that is clear-cut, black or white, that tells us, yes, you should do this, or no, you shouldn't do this because it does or does not have an effect. The evidence about widespread use of masks isn't that clear-cut. We have some observational evidence that we can see based on other countries, but it's hard to pull out exactly what effect masks have, because usually wearing masks, especially in a lot of Asian countries, is just part of a set of public health strategies. So again, it's hard to just pull out exactly what the effect of wearing masks is. On the other hand, most of the experimental work that's been done on the effectiveness of wearing masks has either been in healthcare settings, where without a doubt it's effective, or with relatively small sample sizes that make it hard to know what to predict on a widespread level. And so we're left with this kind of catch-22 between two camps of experts. One set of experts says, well, why bother? Because we just don't know if it's worth it. And another set of experts that says, well, it can't hurt and it might help. And in fact, we see this different lines of arguments even between the World Health Organization and the Centers for Disease Control and Prevention here in the US. The WHO internationally says that fabric masks should not be used. The CDC here in the US suggests that fabric masks are better than nothing and can be used as a last resort. So how do we make sense of these different arguments? So in the camp of experts that say it's just not worth it, a key concern is that because they just don't fit very tightly, these handmade masks or surgical masks, that there's still a significant risk of contracting the disease, that a mask alone is not going to be sufficient to protect you completely. And staying home, social distancing, washing hands, all of those have more effect than wearing a mask does. So maybe wearing a mask isn't worth it. It's also a case where you're trying to balance people's behavior with, what a potential scientific benefit might be. All of these masks depend on using them appropriately. If you put it on, you go out, you need to immediately take it off and throw it in the wash. If you leave it lying around and touch it again, then that's now an added source of infection. And a third line of argument is that masks can sometimes give people a false sense of security. So if people are wearing masks, are they less likely to stay home and do all the other things that we're supposed to do? So those are kind of the arguments from people who say it's just not worth wearing masks. Now, on the flip side, those who say that we should be wearing masks because it can't hurt and it might help, really speak to the fact that, okay, so these let some of the smaller particles in, but blocking the bigger particles is better than not blocking anything at all. And if we can even add that marginal level of protection to ourselves, add that to marginal protection of others, then it's better than nothing. It can be a visual reminder, a very personal reminder not to touch your face. And they even argue that if everybody starts wearing masks, then it actually starts to reduce the social stigma of wearing a mask. Right now, here in the US, because there's really only a minority of people who are wearing masks right now, many people kind of, give a second look at somebody who's wearing a mask and wonder, is that person sick or not? And I think what's really raised awareness about this issue, particularly for this disease, is that there are so many asymptomatic people who could potentially be spreading the disease. As we've learned more and more about this disease, we're starting to see the extent to which people can be already infected with the disease but not show any symptoms. So with what we know now, it's not enough to say that, oh, if you're not showing symptoms, you don't need to wear a mask. In fact, this may be important for everybody to wear masks to stop that asymptomatic spread. And as we start to taper out of this very strict set of guidelines about social distancing and start to interact more out in the outside world in the coming months, then I think we'll see more and more people wearing masks as that additional protection. So to kind of get back to, I think, what the bottom line shows now is that we really need to minimize the need for masks in the first place by staying home. That is still the most effective way to protect ourselves. We also need to prioritize getting medical grade masks, both the N95 and the surgical masks, to healthcare workers on the front lines, either by donating supplies that we have in the community or by being proactive in calling our legislators to take broader action. And then for ourselves, this still comes down to an individual decision right now, but I just made myself a mask this morning. I'm not going out very often. Maybe I go to the grocery store once a week. But if I'm mindful about how I use it and make sure that I'm using it correctly, then it can't hurt, right? So that's the piece that we have to be mindful of. Just making sure to protect ourselves, protect others, if we choose to use a mask by using it correctly. But still, best of all, stay home as much as you can. Thanks again for joining me today, and we'll be continuing the conversation in the coming days. Be safe.